Hey, Eyes and Shine there, my friends and colleagues, and welcome to the I Give a Damn podcast, made possible by Fluorescein Media, the same company behind ODs on Facebook. Today we are joined by Dr. Elza Shearer. Elza is a pediatric optometrist practicing out of New York City. She's a fellow of the American Academy of Optometry, and she's an adjunct clinical professor for SUNY through the Woodhull Medical Center. And today we'll dive into not only how she found her passion in pediatric optometry, but how she views visual development as playing such a critical role in both learning as well as behavior. We also are going to touch on how she discusses myopia management with the many parents of the children that she sees, as well as her other passion of teaching as she plays a mentor to both optometry students but also for undergraduate students as well. So if you've ever been like me and find working with young, small children to maybe push you a little bit outside of your comfort zone, then I think you're gonna get a lot out of this discussion. So please hit that subscribe and follow buttons. And here we go with Dr. Elza Shearer. Elza, first I have to ask, are you a fan of the movie Frozen?
I am a fan of the movie Frozen. And needless to say, I shot up to fame when the Disney musical movie came out. And it's oftentimes one of the connecting points, especially with my young patients. So I just call myself Dr. Elsa. I have that immediate connection.
I figured that was probably a good thing that you had. Like, as soon as I saw, I'm like, oh, if you do pediatrics, that's amazing. Like, every young little girl is probably going to just be like, oh, Elsa, you know.
It's true. I mean, I think I have some rivals now with like Moana and some of the other more recent princesses, but you know, I can still pull the Elsa card here and there.
I feel like that's still such a huge thing that every kid, I mean, we have that in our clinic. We have, you know, we can put movies up on the screen. So while the kids are dilating or something, they have something to watch and distract them.
Right. I mean, Let It Go is a classic, and every little girl and boys, you'd be surprised, can sing every single word of that song.
Can you break out in the song while you're singing?
No, I'm not going to be breaking out in the song right now, but usually I try to sing along with them, especially to distract them when I'm trying to do something that they don't like.
So since you're in, tell us a little bit more, since you do pediatrics, but do you mainly do pediatrics, or do you see all walks of life?
I've had a really interesting 7-year career since graduating in 2015. I've practiced in a variety of settings. I've practiced in 2 different private OD settings. I've practiced in ODMD settings. I've practiced in hospital. I've practiced in high-end retail. So I've really practiced in a lot. I actually, in the past year, I went through a major career transition. I was at an ODMD practice seeing almost exclusively pediatrics and doing adult strabismus. Wow. And then I transitioned over to a private OD practice in the fall of 2022. And now I see cradle to grave. So it's great. Peds is still my specialty, and I'm still teaching 1 day a week in pediatric optometry at Woodhull Medical Center, which is a public health hospital here in New York City.
Oh, that's awesome. What is your experience like seeing in like a public health hospital setting like that? I mean, do you see a lot more disease? Do you see a lot more poverty?
So it's so interesting, because when I was at the ODMD practice, we actually practiced in the Bronx and East Harlem and Forest Hills. I actually saw more disease in the Bronx, I'll be honest. I think I see a little bit in Brooklyn where the hospital is, but I would say the Bronx I saw more. I also was just seeing higher volume of patients, so possibly just because I was seeing more, I just saw more disease. But thankfully, I the other day I had like a really crazy schedule, and it was like almost everybody had some sort of ocular disease. It was at the hospital, and I was like really grateful for my experience, because I could just get through my day. I'm like, oh, this is normal. I think my residents and students are sweating, but I'm like, you guys, it's fine.
We definitely get those crazy days. I think every OD out there can get that same feeling where it rains, it pours.
Sure.
And you always get that patient who at the end of the exam, you're getting through it. Oh, by the way, I've been seeing double for the last 2 weeks. It's getting worse.
Right.
And you're just like, oh no.
Right.
So you have this love for pediatrics. That's been a specialty of yours. How did you get into it, and how did you even get involved with practicing in the different modes that you've been through in just the last 7 years?
So it's really interesting. I didn't really fall in love with pediatrics until my 4th year in optometry school. I was the kid, like growing up, I never was interested in kids. I wasn't like the teen who always wanted to babysit. Like I wasn't really interested until optometry school. And I didn't go into optometry school thinking I was going to be a pediatric optometrist or find that specialty. And so that was really the importance of clinical externships and being exposed during that time that I really got to fall in love with pediatric optometry. And I ended up applying for a residency, and I matched at SUNY, so I ended up staying on at SUNY to do my residency. And then I kind of cobbled together my schedule here and there, and I've made a ride of it so far.
So did you have like an experience like with a specific patient, or you just really had a real good relationship with mentors who were in pediatrics?
It's
like what was
really the patients. I do it for the patients, definitely. They inspire me. I love the creativity that pediatric demands. I love that you really have to be trusting of your own findings. You know, oftentimes with adults, you can already write your assessment and plan by the end of case history. It's not the case with peds. So that part I really like. I like that I have to rely on my own skills to get to the bottom of whatever's going on with them. They often can't advocate for themselves. I have to be a voice to the voiceless. So all those things really, I find it very rewarding. Plus, kids, they don't complain. If your prescription's slightly off, you're not going to hear about it.
I think there's definitely some truth to that.
There's other things about kids. And then also working with families and just seeing how they grow up. I don't know. I could go on and on. I think peds is great. I'm a huge advocate. I find joy in it every single day.
I know from my own experience, I think there's some I definitely resonate with that, especially after being in a clinic. I worked in a clinic for about 5 years.
Sure.
And watching like a young kid that I helped with, you know, he had like a red eye or any sort of medical issue.
Sure.
I have one patient in my mind. I remember seeing him. He got hit in the eye with like a birdie from playing badminton.
Oh, yeah.
And his parents were freaking out, and he was freaking out. He had a hyphema developing. But then I saw him, you know, like 4 or 5 years later, and now he's like learning to drive in high school, and I'm just like, whoa.
What happened?
And they remember me taking care of them at that time. And
Right.
so I believe those sort of bonds, that's huge in growing
Sure.
a clinic, growing your practice.
Sure.
And I think you feel good as a practitioner, like, wow,
Absolutely.
I'm making an influence on this person's life, you know, and hopefully, obviously in a good way.
Correct. Yeah. I mean, you can really, your early intervention really changes the trajectory of the child's life. With a simple pair of glasses, it doesn't even have to be that complicated. So, you know, just having, you know, opening that door for that child is just really powerful. And I think it's magical every single time. And so that's why I get up every day and I go to clinic and I get to help them out.
I think the kind of the interesting that you mentioned that you have to rely so heavily on your objective data, on like what you're seeing and experiencing, because I think on the flip side, something that always made me so uncomfortable working with kids was the fact that I don't trust them. Like I don't trust their responses, their visual acuity. I don't trust that at all. You know, kids lie. They lie all the time.
They do.
And so
They have different motivations.
They do. And then you're dealing with sometimes a parent who's overbearing and like
Correct.
just, you know, they're like yelling at the kid because they can't read the 2020 line. Like they're angry. I'm like, what are you doing? Like,
Right. It's
why
not
are you
helpful.
coaching? Yeah, you don't stop coaching them. So I think there's definitely a mix. And now you have no, you don't have externs. You don't have students.
I do have students
You do?
and residents at 1 day a week at the hospital. So
Okay.
yeah, not at the private practice.
What's your experience working with both students and residents and their experiences, watching them grow working in pediatrics? Where do you
Sure.
see them specifically struggle in an area?
So it's interesting because not a lot of students get that much pediatric exposure. Or if they do, it's like very spaced out. It might be like 6 months between when they've done a peds exam last. And that's like obviously a very long time when you're considering their training. So the other thing too is that a lot of times they're experiencing coming into my clinic is only on campus. And so on campus clinic, you know, it's very academic. The exam's very slow. They're looking for every little minutia. I mean, I understand you have to teach them how to do all the things, but in real life, we don't do all the things. It's a very problem-oriented exam. I have a lot of flexibility in my exam flow. And so trying to teach them how to think critically, it's important to know all your tools in their toolbox. I say it's really important to be really good about that and be able to pick one out whenever you need it. but we mix and match as we need to throughout the pediatric exam. And so something's not working, you got to switch, and you got to switch quickly.
Sure.
And so trying to teach them that, and then also teaching them it doesn't have to be this like drawn out process. Not every child needs vision therapy. Like, it's not all about vision therapy in the real world. Most kids just need glasses, or they need allergy drops or something like that. Like, it doesn't have to be that complicated.
And I feel like, at least when I went to school, and you and I went to school the same year, we both graduated in 2015, I feel like a lot of my pediatric knowledge and training did come from VT classes.
Right.
And so I think we maybe are pigeonholed into that a little bit of just thinking, oh, check binocular vision.
Right.
And
yeah, I mean, it's important, but there's a time and place.
Mm-hmm.
Right. Most kids just need a really good refraction. They need a good cover test. You want to check basics of their binocularity and a good ocular health assessment.
Mm-hmm.
And then you mix and match based on, what you're seeing, where you think that exam is going, and what really is the priority for that exam. So, really trying to teach my students, it doesn't have to be this like bogged down vision therapy workup. Like, that's not a primary care pediatric eye exam. And really trying to make that connection with the child, and then critically thinking about how to best manage the child in the context of their family at the end of the exam.
Sure.
So, and they can do it. It's just a lot of times they just really haven't even had the opportunity to prove that they can take care of a child competently. So.
I'm always curious about this, but what's your current protocol or your ideal protocol of full cyclo, damp refractions? For young kids, like what's your...
Sure. I mean, I think, as per AOA guidelines, you want a good baseline cycloplegic refraction for pretty much every child under the age of 12, let's say. You want to get at least a good baseline. After that, you really can be kind of case dependent, depending on what's going on with the kid. If there's amblyopia, if there's strabismus, maybe you're going to be repeating that cycloplegic refraction from time to time. The vision is reduced for some reason. Always go back to a cycloplegic exam. So it's obviously my first exam. A new patient always get a good cycloplegic refraction, and then after that, it's kind of case dependent. So again, it's also practice setting dependent, because, and for example, my former job, when I was seeing really high volume and I was working with a lot of techs, almost everybody was cycloed, just to kind of streamline my process, because I didn't have time for subjective refraction necessarily. So I was prescribing straight off my objective. So I really think it's setting dependent, it's case dependent. It really depends. Again, being flexible. And I also think, I teach this to my students too, is that you're the professional. You need to meet the demands of the clinic. So you need to be able to adapt your exam in order to meet those needs. So being creative and being, obviously without compromising the quality of care. The
quality and standard of care.
But being flexible within that kind of paradigm, and knowing the benefits and the shortcomings of every different way you're practicing in every different setting. So if there is a problem, you know how to troubleshoot it.
So what do you think about like pediatricians, family doctors using like a Welch-Allyn autorefractor during their wealth checkup or their health checkup? And
Maybe we're shaking pennies out of those kids.
but well, in a way, I'm sure the insurance that's part of it. But what do you think about that? Because they're doing those screenings with that undilated.
Sure.
And then they're telling, they don't need to see the eye. They're telling the parents, you don't need to see the eye doctor. They did a scan. They're fine. Like, it's
interesting, because I actually find that the Welch-Allyn is sometimes a little bit more sensitive, and it's picking up more things than just a visual acuity screener. So I have mixed feelings about that. I have a lot of opinions about really thinking about your eyes as a tool for learning. I think that I would love to see more pediatricians, more parents, more teachers think about vision as a tool for learning. You get your Chromebook and you get your pencils and you get your really cool crayons every year before going back to school. But the most important tool is right here on your face. Have we checked that? So that part, to me, I would love to see move the conversation forward as far as checking the vision, checking the eye health, seeing what's going on, especially if there's an issue with behavior, with attention, with academics for the child's life. oftentimes, sometimes we get these patients who've been in their third or fourth grade at this point. They're having major issues in school, behavioral, they're in special ed, blah, blah, blah. Meanwhile, they just need a pair of glasses, and nobody thought, hey, let's check their eyes, because it can be something as simple as that. Even if they're passing the vision screening in the pediatrician, they need a full comprehensive exam with a trained eye care professional. So
now, I'm not familiar with the state of New York here where you practice, but is there any regulation about children need to be seen for an eye exam before starting school? Is it in grade level? Is there any? To my knowledge, there's not necessarily those types of mandates that there are in certain other states. I think that there are, at least in the city, they're trying to do a little bit more school-based type of just like vision screeners, or
well, it's optometrists going in, but it's a little bit of a limited exam because sometimes they can't dilate the patient.
Sure.
But at least it's an optometrist that knows how to do a good cover test, a good retinoscopy, is able to look at their motilities or basic binocularity, even if it's set up in a school gym, for example. A lot of times you can still get a doc who has good experience and trusts their skills and get somewhere in that type of setting, more so than just the school nurse, for example. So there are some movements to try to bring access to children like that. I think it's just, to me, it's more about making that connection between vision and learning, just overall.
With like your practice, you guys, of course, are not just, you have some level of VT or someone you refer to. Do you personally do?
We do home therapy. It's interesting. We prescribe home therapy out of our private practice. I co-manage a lot of vision therapy. There's a clinic actually pretty close to the hospital in Brooklyn. So I'm able to, and that's convenient for families, is that proximity. Somewhere, if you're going for in-person vision therapy, it's nice to have that offer in your neighborhood, right? So I co-manage over there. At the private practice, we actually just wrapped up a beta project with a home vision therapy program that we were co-managing with. So I'm really interested in how like the home VT, the virtual VT, is going to develop. We find that home VT is more geared towards our adults right now. So it would be really great if we can find something that's better for the kids.
Sure.
So we've had, I think that's a promising horizon for flexibility. Making that commitment to come in weekly for our vision therapy appointments is a big commitment for many of our families. So trying to be flexible with what we can do between our primary care setting, home vision therapy, and possibly some sort of either virtual vision therapy with an optometrist who's willing to offer that, or some sort of virtual program is nice.
Right. I think it's exciting to see so many, not just in the VT space, but like where just virtual consults are able to go.
Sure.
And then there are a lot of other countries, whether it's the United States or in Europe, that are looking into different programs or VR,
Correct,
virtual reality. Like how can that be utilized in that same space?
Right.
So. Hey, I just want to take a quick pause and give a shout out to Florissene Media. Not only do they make this podcast possible, but they are the company behind the social media community ODs on Facebook, which is the longest running optometric community with the most active discussions amongst over 46,000 eye care professionals. So, if you're not already a member, don't miss out and join the discussion over on ODs on Facebook. Otherwise, let's get back to it. Beyond just vision therapy, I know you do some myopia control, right? I feel like if you're doing pediatrics, you can't not be paying attention to myopia control.
Right. I mean, right out of the gate, I've been practicing with myopia management since, during residency.
That's right. They changed the term. They changed it from myopia control to myopia management.
I don't know. It just, the double M's is like more appealing, I guess. I don't know.
It's probably a little bit more accurate too.
Correct.
Right. We're managing
it. Right. We're not controlling it, sure. But I've done a ton of atropine treatment. Okay. That's, particularly in like the outer boroughs, for example. But now that I'm in a private practice, I'm fitting more contact lenses. So I'm getting more into the multifocal contact lenses and Ortho-K. So I think it's an exciting time to be a pediatric optometrist, because I think myopia management, and I mean, it's the tough thing, I'll be honest, I think some of the issues with docs even seeing peds is that it takes a lot of time and you don't make a lot of money off of them. So let's just be honest. That's just like the reality of it. Plus, they take up a lot of space because at least 2 humans show up for one appointment, if not like 4 or 5 humans show up for one appointment. And so just the footprint of seeing peds becomes, arguably an issue, especially if you're going to see a lot of it. You need waiting room space. You need bigger exam rooms. Blah blah blah.
I didn't even contemplate the whole families, especially in some cultures. Like
Yes.
when I lived down in Texas, there's a lot of Hispanic culture, and the entire family shows
Sure,
up. You
correct.
don't just have mom or a brother. You have grandma and grandpa came with
Yes,
too, and they all want to
exactly.
be in there during the exam.
Exactly. So, I'm hoping that as docs find that we can find more financial rewards for myopia management, I'm hoping more docs will be more open to that, because depending on how you structure it, you can make it a good cash flow for your practice as well. So that's exciting for me, and I'm hoping folks kind of brush up on their skills, so to speak, are more willing to take a stab at peds and find that it actually is really rewarding. And myopia management works.
Yeah.
It's also rewarding to keep the kid at their -2 for like several years if you can, and maybe they only go up at 250. Great, like you did your job, and it really does work if you're committed to it.
Do you find challenges? This is just from, I think, our clinic, and it could just be based on our geography. Do you find challenge getting their parents to understand what myopia management or why we need to do this?
Yeah, so it's really interesting because, as you can probably tell, I've practiced in many different settings and many different cultures. So I think having that cultural mindset, you have to really adapt how you speak to every different family, right? Mm-hmm. So I think for a lot of the folks, for example, in the Bronx, it's like a lot of immigrants. So a lot of times those parents no one has ever worn glasses. And now all of a sudden little Johnny is like a -2 and they don't understand that they need glasses at age 7 or whatever. And they're like mortified, right? So sometimes that can be a little bit more difficult just to even get the child to wear their glasses versus somebody on the Upper West Side. Mom and dad are -7, -8, little Johnny's -2 and he's 7. It's a completely different conversation. They're like, doc, how do we keep my child's prescription as low as possible? So really adapting that conversation based on kind of where you're practicing, what kind of family setting you're dealing with. In some families, they come in asking for it before I even bring it up. So so that being said, when I'm trying to get a family on board, I really try to think of it as long-term management. And most, parents love their kids. They do care about long-term, this is best for your child. When they're an adult, I'm not only helping them with their vision now, but the long term, this is going to affect them for the rest of their life. I'm controlling their factors, not only for their vision, but their eye health. And then they're like, when I say, glaucoma, retinal detachments, things like that, they're like, okay, let's do the drops. And then sometimes I call it an eye drop vitamin. And it's really easy for them to kind of jump onto that idea because a lot of them are already giving their kids vitamins anyway. So this is kind of like a vitamin for your eye. It's more prevention. It's really prevention long term. And this is how it works. It really just stabilizes it from getting worse.
So that's an interesting, one of the challenges that I've ran into is because we will get a parent,
Right.
both parents who are -7, -9.
Right.
One's had LASIK, one's in contacts, and I try to tell them the risks. I've tried to sell them the risks of floaters or detachments or glaucoma, maculopathy, and some just don't buy it. They don't see it as a problem.
Sure.
And that. So I kind of run into that. Have you ever had that issue?
So at the end of the day, it's still an optional treatment, arguably. So
for now, maybe, right?
You can't. And just like any sort of treatment, whether it's a dry eye treatment, myopia management, whatever you're doing, sometimes the first conversation, it's a no-go. And that's fine. Okay, you know what, Mr. and Mrs. Smith, they're not going to do myopia management for little Johnny today. That's fine. But I'm concerned about Johnny's vision. So I'm going to see him back in 6 months, and we're going to be monitoring every 6 months. And if I see it go up by half a diopter in 6 months, then it's a different conversation. Because you can say, that's progressing at 4 times the rate they should be or something. And sometimes just a second, third conversation, you can start to introduce that concept. You know, a lot of parents don't want their kids in contacts. Some parents don't want to use eye drops. Thankfully, we're starting to have more and more options for myopia management. So again, it's kind of tailoring your treatment based on the family values. If they can get a drop in every day, great. Some families think that that's really easy. Some families are like, no, I don't want my kid on medication. Fine, then we could talk about contact lenses. And if the parents are in contact lenses already, it's kind of a little bit easier. So,
what about lifestyle? Do you ever what kind of just regular lifestyle coaching? Do you just tell them spend more time outside?
Right. I mean, it's tough. I mean, it's interesting because your most recent conversation with Dr. Ostrin, she was saying how like there's kids are like only outside like 40 minutes a day or something like horrifically low. I'm just like,
I hate to admit that was me growing up. I was still that was how many 20 years ago?
Yeah, so it's I think we're especially in the city because it's not like you can just like send your kids to the backyard. Because children, you know, usually need to be like supervised to some extent outside. Here in the city. So it's not just like, okay, just go out to the back until dinner's done and getting that extra few whatever minutes in before like the after school time. It's amazing to me too, because many of my patients, I speak to them about outdoor time, and some of my patients say they don't even get to go outside for recess, which I think is like cruel and unusual. I don't understand it, but there's some kids in the city, believe it or not, they're not even going outside for recess, which is like bananas. That's its own issue. Kids need to like be free.
So their only time outside is like from going from like the bus into the car,
right,
or from the school into the bus, and then from the bus
right,
into the house or
right,
something.
I mean, my conversation is always, you know, parents think it's the screens, and I say no, it's not necessarily about the screens. It's about prioritizing outdoor time. I don't want you to think about the screens. Everybody's going to be on a screen. I don't really want the message to be screens are bad. I don't think that's actually helpful. I'd rather say, but outdoor times is best. So like, let's prioritize outdoor time, and 9 times out of 10, they're not gonna be on their screen when they're outside. So even if it's a walk around the block, I don't care. Walk your neighbor's dog, you know, find something, whatever you can negotiate between the child's caregivers, whether that's aunt, uncle, babysitter, grandma, whomever. Like if we can even just get 30 more minutes a day outdoors, that's great. Like just stopping at the park on the way home from school, like let's just do it. And we can kind of squeeze in those minutes. So that's kind of my approach. I don't like the screens are bad message. I think that can arguably be a little bit harmful to kids. You have to understand they're very impressionable,
and they
like
don't have a choice.
They don't really have a choice. They're on their Chromebooks or whatever for school. So, you know, trying to temper that language, I think is important.
And their favorite thing to do is play the video games. So you're telling them,
right? I
that's
mean,
bad,
I like to say, you know, try to play with 3-dimensional toys. Like go back to your blocks, go back to like G.I. Joes and dolls, and have that creative play.
Sure.
So, you know, it's not about them not having their free time and not having their play time, but about varying those types of activities if they have to be indoors for whatever reason. So, you know, it's a delicate conversation. I'm very aware of what the child is hearing coming out of my voice, because I think, you know, I arguably have an authoritative voice in their young like mind, and you never know what is going to hurt or help a child. One doctor, one adult in their life says something. So I try to, you know, walk that line carefully, I guess.
Right. I want to kind of switch to a different question.
Sure, please.
Now, I know passion-wise, obviously you're seeing patients. We love taking care of our patients. But you also have another huge passion. You teach. You have students. You have externs. You mentor not just students and professionals in our own space, but like undergrad students. Is that correct?
Yeah. So it's interesting because two or three local universities started pre-optometry clubs in the last 5 years or so. And one of pre-optometry students were techs at my former job, and they were like, they were trying to find ODs to like come and speak to their pre-optometry club. So then I kind of like jumped on board. I honestly, I love it. I think it's also really good for me to realize like how the students are changing. Like they're like much younger than me now, which is like wild to think about.
I had an experience where I went to a high school just to speak at like a healthcare fair about like what we do as an optometry, and I thought in my head I still felt like a 17-year-old.
Right.
And even though I was like 30 walking in, I'm like, I know how these guys think. I know how what they care about. And then I walked in, I'm like, this is terrifying. Like totally they don't care. They are not paying attention.
Exactly.
They're looking at their phone the whole time.
Right.
And I'm like studying this classroom, and I'm like, which one of you kids was me?
Correct.
Oh, that weird kid in the corner. You know.
So it's good for me to kind of like, especially since I train students in residence, to try to be up with the times, so to speak. But I think it's really great to just kind of overcome a lot of their very common fears, or just give them that confidence. You know, they're really bright students that are studying their butts off. They're doing all these extra things. They're doing research. They're doing internships, like all this kind of stuff that I definitely did not do to get in optometry school. No, it was not that cool, I guess. They're like bending over backwards. I'm like, guys, you're gonna get in. Like, as long as you clearly have shown like you're committed to the profession, you can handle the course load. If this is what you want, it's just literally filling out the application and doing it. They're
don't
gonna
show
want
up to
you.
the interview like just wearing pajamas.
Correct. Like if you have it together and you turn your stuff in on time, like you're gonna be fine. So you know, maybe I don't use those exact words, but it's just kind of coaching them through every little bit of it. So I've had several pre-optometry students get accepted, which is so super exciting. There's one.
Did they send you thank you letters?
Yes, I try to keep in touch with them, because it's also important. I think it's to like have that lifeline on the outside, because in school it's kind of disorienting. Like, you think you know what you're getting into, then you're in school and it's nothing like what you thought, and then you're like, wait, what am I really doing here? So having that doc to like reach out to about whatever exams, boards, whatever's going on, reassuring them, like, you know, when I started in first year of optometry school, I was terrible at retinoscopy, and now since I've done literally tens of thousands of eyes, I'm really good at it. So don't just remember, I started the same place you did. Like, it's going to be fine. You just have to practice a ton. So just reminding them, like, the end is definitely not what it's like. The journey is, like, not what it's really going to be like on the outside. So I find a lot of joy in it. There's actually a non-traditional pre-optometry student that I'm mentoring right now, and she's deciding between two schools. And so it's been really cool to just see her journey and things.
By non-traditional, what do you?
She's basically, she's an optician, and she finally finished her undergraduate degree, and she's, you know, in her 30s, and she's applying to school to become an optometrist. So she's just had this winding path, and it's, you know, I think it's really great to have that kind of diversity in our field, especially coming from opticianry. I'm like, you're going to be way ahead. Eons ahead compared to your classmates. Trust me when I tell you, because you actually know how to talk to people. You know how to deal with patients. Like, that is a huge, huge advantage. And just not to mention just understanding how glasses work. Like, you're just at a huge advantage. So, you know, just trying to reassure her through this process, and just see her passion. And the fact that she's so motivated at this stage in her life is just inspiring to me, because I can't say that I would do the same. So
I think you definitely hit a nail there about being prepared to talk with patients or understand how to communicate.
Correct.
Because I remember when I was in school and I shadowed like a summer, the summer between first and second year, I went and shadowed at an optometrist, his office, and I was really nervous to talk with people, or to be like a tech, or just do the basic stuff. I just didn't know how to come across. Correct. I wasn't sure of myself. I still over-explain things, but I was, somebody asked, like, what do polarized glasses do? And then I start talking about, like, the polarized filters and try to explain scientifically how light bounces off flat surfaces, and they just stare at you.
days over.
Yeah. So I definitely, it took a long time.
Right.
And I remember, and then of course the way you talk with kids versus
Sure.
the way you talk with a 70-year-old war vet
Correct.
at the VA or at a private practice, like
Right.
it's all very different.
It's all very different.
So
Right.
I think that's going to be a huge asset for that student that
Exactly.
you're talking about.
Exactly.
I remember in our school, they kind of played with an idea of having questions that a patient would ask on like the back of a card.
Right.
And as a game, you wouldn't know what it was, but you had to answer as quick as you could. Whoever had the best answer, you'd flip it around and like on the spot, like be able to answer.
Oh, wow.
We never did it, but I heard somebody talking about trying to see how people would do with
yeah,
that.
that's a good idea. I think communication is definitely a skill, and the more ways you can practice it, whether it's amongst your classmates or with supervisors or with actual patients, the better you get out of it. And it's something that docs are I'm constantly developing my communication skills and how I speak to patients. So, the profession is constantly evolving, just like we were talking about myopia management. So you have to like learn a new vocabulary and how to speak to folks. So, it's, to your point, like just communicate. You have to be a good communicator. I was teasing, I talk for a living. I literally talk for a living. Optometry just happens to be like, I do a little bit of optometry and mostly talking. So, you have to be a really good talker.
Yeah. Have you ever lost your voice throughout a day of exams?
I haven't yet, but maybe that's why I have strong vocal cords or something.
Right. I've definitely gotten close. I've gotten where it's like I've been like double, triple booked all day long,
Right.
and it's like getting around 3:00, and I'm like, I'm just exhausted,
Right.
and I'm just sick of talking.
Right. I'm really careful about taking those critical breaks and like closing the door for like 2 minutes. Okay, I'm going to do nothing but drink water for the next 2 minutes. Leave me alone.
That's really smart and self-awareness that you have. I think
Right.
that was one thing mentors, when I did my residency, there was a day I almost passed out.
Oh, wow.
Because I wasn't drinking water. I
Right.
wasn't taking a break to eat.
Right,
At the
right.
VA I was at, we really didn't. My other co-resident and I we were lucky if we had a moment to stuff our heads in the locker and just eat a bite of a sandwich in
Sure.
between patients. So,
Right.
there was a day I just,
Oh, wow.
I fell down into a chair
Oh my
because I was
gosh.
just exhausted.
That's so bad. I mean, I'm at the hospital. It can get crazy at the hospital, definitely. But I try to teach my students and my residents. I'm like, we work hard so we can play hard. We work hard to be done on time so we can have,
Life.
the hospital, we have a scheduled 1 hour lunch. So if you work really hard, you can actually take a whole hour. And I show them you can streamline your exams so you actually have time to eat. You can get up, stretch your legs. You can actually go outside and
Right.
see the sunshine for a few minutes. It's so important. It's really important to have that kind of, approach to work. And then like, if we work hard, we can be done on time. And then you get to go home to your family and do whatever you want to do, on time. So not to say that you should rush your exams, but I think when you do have an opportunity to break, I tell them you have to take a break. It's very important to take a break. So I try to instill that into them because they, sometimes they just like, oh, I don't want to eat. But I'm like,
Right.
no, you're going to kill yourself.
Yeah, if you're not taking care of yourself, then
Right.
how can you show up 100% for your patient and take care of them?
Absolutely. So I definitely practice what I preach because I get hangry.
Yes.
When Dr. Shear starts to get hangry, it's time for a
People know.
timeout.
It's like that Snickers commercial. That somebody
Right,
has
like
to give you a
it's bad,
Snickers.
it's bad, and nobody wants to be around me. I need to take a break.
What? So was there, since you have this passion for mentorship,
Right.
did you have big mentors before optometry and then maybe in optometry school? Like, who were some of your mentors?
Yeah, I mean,
what do you remember?
I have a huge advantage because I actually grew up in my mother's optometric practice.
Oh, cool.
Yeah, so I literally from age 4 months on, I've been in optometry practice. So
It's like in your blood then. That's great.
yeah, literally. And, I got off the bus in middle school at my mom's practice and I would do like confirm the appointments, pull charts when she was still on paper. And
What a good way to get someone to say, yes, I'm coming in, when this like 8-year-old's voice is like, are you coming in for tomorrow's eye exam?
I wasn't that young. Okay, give my mom a break. But, and then I,
There might be child labor laws
right.
for that. I don't know.
Right. I was working, whatever, 2 or 3 hours. I don't know. But then I worked up to like teaching INRs and then scribing and all this stuff. So I think that it's interesting too, going back to our communication, because a lot of things I still say are directly from my mom. I'm like, wow, that's literally, Dr. Biling coming out of me right now. So I'm very, very fortunate. And her partner, Tim Early, has also been a really great mentor to me as well. And then, I also grew up she went to Ohio State. So I went to Ohio State a lot. Always went to the alumni the parties and things like that.
I think of all the schools I've ever heard, and I'm surprised you didn't go to the Ohio School of Optometry.
Yeah, I mean, I applied to SUNY in Ohio State, and I ended up going to SUNY, and then I've stuck ever since. So it's just like...
So it was a perfect fit for you then.
All right, thank you, yeah.
But it seems like anybody, whether undergrad or optometry, I feel like the Ohio State those students speak the loudest and shout the loudest about their passion for their school, which I don't blame them if it's a good school.
Right. I mean, it's a definitely different vibe, because it's the optometry school is right there on a campus that's has a huge university, so you get the whole university experience. Unlike at SUNY, it's just like one building and it's just optometry. So, it's a totally different vibe. I got my undergraduate at Ohio State, so I had that college experience, and then I decided to spread my wings a little bit for optometry school. I honestly, when I applied to SUNY, I definitely didn't think I was going to stay in New York City. That was not the plan at all, but here I am. So
right. I think your passion for the idea that, having a passion for mentoring, passing down your knowledge, watching, you're really giving back to the profession in many ways that way. Because if you love the profession, you want to talk about it. You want to help other people not fall into the same pitfalls that you did.
Sure. So this is my biggest thing, is that I think that especially early on in my career, you go from being around like a bunch of docs and a bunch of students to just being by yourself. And at the ODMD practice, they would just put me in a corner, because nobody wanted to deal with the kids. So I was always practicing by myself. So I honestly felt really isolated, and I was trying to find ways to like reinvigorate my passion for the profession. And I think it's really important to have those things outside of the exam room to keep you going, because if you're just spending your days in small dark rooms and talking to strangers about which is better, one or two, it can be draining, let's be honest. And so having these other things, having these other outlets, it reminds you why you're doing it, and it keeps it fresh. I think it's really important to find, it doesn't matter what it is, whether it's research, writing, speaking, something like this, interviewing, like having a little bit of something on the outside to make the profession great. And it's a small profession too. We all really need each other. It's a small team, so to speak. We all really need to support each other. And everybody, we're all in a different stage of our careers. We all need different things from each other at different points. So I definitely would not be in the place I am today without the amazing mentors that I had. And a lot of these students, a lot of times they're like first generation college goers, the pre-optometry students that I'm mentoring now. And so like they really have it's like a whole new path for them. So they're really blazing the trail on their own. And so it's just, to me, I find that inspiring to like really find that and go forward, because arguably my path was relatively paved for me.
Because you had a family in it. And you were kind of
exactly. So, I need folks, they need folks, we all need each other. And this is something that I just keep coming back to.
Well, I'm really happy that you are focused on that and that you're speaking about it, because I think in a way, a lot of what I've been trying to accomplish myself and is because I feel the same way. I want to be able to share not only our knowledge, but kind of pass things down, whether it be to other professionals in the space or in my passion is speaking even more to the public of like, just trying to get them to understand 1% more of how important their eyes are and seeing a doctor, getting things treated sooner, lifestyle changes. Like that can pay dividends for your entire life.
And there's so many like myths out there. There's so many myths out there about people really don't understand what's really going on. So I really appreciate your work. I'm very appreciative to try to debunk one myth at a time.
And the tough thing is that for every one myth you try to debunk, there's 10 more,
10 more.
weird gurus in their basement who say the opposite,
Right.
who are trying to, if you read into it, you can hear that they're actually selling some sort of a weird vitamin or an eye drop that isn't FDA tested or approved. And
Right.
there's always something.
Sure.
Right? But I love to ask this, with what you've experienced in your practice and profession, what do you think, at the end of the day, what often frustrates you? And if you could snap your fingers to fix one thing that would make optometry better?
That's a really tough question.
It is a tough one.
Wow. I have not thought about this to make optometry better.
It doesn't have to be one. If there's a few things.
Yeah, I mean, obviously, public awareness, I think, is high up there. I think one of the biggest things is folks valuing their skills and valuing what they bring to the table. Sometimes what I get frustrated with is folks not keeping their skills up or getting kind of lazy or not valuing what they bring to the table. Or I don't want to say getting lazy, but they're just, we really have a big scope and can really help a wide range of folks. And, sometimes like I'm in awe, like I feel like I'm so grateful I can help so many different types of people. And so that part of it, I just wish that folks realize you can really make a big difference. And really valuing that, and what is that worth, and what is good eye health, good vision really worth. And I hope they put the value on themselves and find, not just like self-fulfillment, compensation, it's valuable.
No, it's extremely. And I think that we have so many more skills. Our
Sure.
like you said, our scope is very broad. We do a lot of assessment. We do a lot more than glasses and contacts.
Correct.
We all know that.
Correct.
And sadly, in a world, that's what people still think
Correct.
we do. That's where they see our value.
Sure.
And even our own industry, in a
Right.
frustrating way,
Right.
still markets and sells
Sure.
that, right? How many times do we hear commercials on the radio or whatnot, like, oh, 2 pairs of glasses for $60 and
Right.
the exam is free.
Right.
The exam is free.
Right.
Like,
It's totally wild. It's, yeah. I mean, yeah.
Like-
And I've been in different settings where where the patient just sees me as like a one stop to get their prescriptions.
Unfortunately,
and
that's
literally,
a
it's
lot
like
of
literally, it's like, and so to me, I try my best to add that little bit of value and try to break that a little bit. And then ultimately, I'm not necessarily in those types of settings anymore. But I think even if you're I think there's ways to kind of break through. If you're willing to take that one step or a little bit more energy to show the patient all the skills you have and the value that you bring to their life and their lifestyle.
and that's one of the things I think, if I had a dream clinic of my own,
Sure.
And the clinic where I work at is amazing. I just wish that every exam room had like a giant 80-inch screen TV with a constant live feed of what all of the metrics, like we've done a pentacam, we've done
Right.
autorefraction, we've done this, here's a prescription,
Correct.
like a digitalized version of like being able to show what's going on inside the eye, fundus
Correct.
photos,
Right.
a slit lamp movie that I can upload to their so I wish they could just better visualize. I think that's
Correct.
one of the difficult things for
Sure.
most consumers and patients,
Right.
is that there's so much knowledge. We went to school for how long
Correct.
to understand the eyes, and most people don't know the difference what the cornea is. They don't know what the pupil
Correct.
is, the retina. They
Correct.
confuse what the cataract, glaucoma. They don't know.
Correct.
Right.
Correct.
So
I mean, I think that's an overall trend with medicine, though, because it's like the doctor is in charge of the data. And I think that's a bigger conversation you can have, is like, who should be in charge of the data, right? And I think, obviously it's our job to analyze it and come up with a treatment plan. But there's really a little bit of paternalism, protectiveness over a patient patient exam findings and things like that. So, that's, kind of like what we're inheriting from old school medicine practices. So if you just like put it on a huge screen, I think all doctors arguably are analyzing that same amount of data. And I think it would be overwhelming. It would be mind-blowing for the patients for sure. But then you could actually see what's really going on, the whole full picture. It's a really interesting concept.
My thought is just that you're more likely to take good care of yourself
Right.
if you really understand what's going on. Because we can tell patients to eat vegetables, eat fruit, fruit and vegetables, drink
Right.
more water.
Right.
But just telling them to do that
Right.
isn't really motivating.
Sure.
They know they should, but they're still going to go
Right,
eat,
right.
eat, soft drinks and candy bars and things
Sure.
like that. They're going to go get fast food, but they know they should be eating fruits and
Right.
vegetables. But we're not really teaching them why.
Sure.
I feel like if they understood the physiology of what's going on, they'd be like, oh, okay.
Right.
So that's kind of my thought. I'm like, let's show and teach them.
lifestyle changes are long-term investments. So it's tough because we live such a quick fix. We want a quick fix now, but having a healthier lifestyle, it takes really a long time, arguably, to see some of those benefits. Yeah. It has a lot of commitment.
You could say that just back to myopia control.
Correct. Myopia control, dry eye, anything, right? Managing your diabetes, whatever it is. So again, it's tough too, because prevention is arguably the best medicine. But then if we prevent all of it, then we have nothing to treat.
Sure. Well, I'd love to have. I would love to have that problem.
Let's like make all of our patients see perfectly, and they don't need us. That would be amazing, right?
I always look in the futuristic movies, whether it be Star Trek, Star Wars. Almost nobody has glasses on in any of those those episodes and things like that. And it's like, gosh, what would be that miracle cure other than, we can plug out the eye and put a new one in. That's what I try to tell patients oftentimes. I'm like, look, if you lose your hand, you lose your arm, you can get an organ transplant, you get new kidneys, all these different things. We can't figure out the eye.
Right.
The eye is an extension of your brain. We'd basically be doing a brain transplant.
Correct.
In a sense.
Right.
So I even told them, with all the technology, we're still hundreds of years away
Sure.
from figuring that out.
Sure.
So we have to do what we can now.
Right. Absolutely. Absolutely. That's pretty extreme. Yeah. That would be wild if we could figure that out. But that's far, far away.
Yeah. So, Elza, thank you so much for being here.
Yeah, of course.
Let me know right now, other than mentorship.
Sure.
What do you give a damn about? What do you really care about our profession? What drives you to find success? You're continually doing, not just seeing patients,
Right.
but you're mentoring. You're basically teaching. You also won an award recently
Right.
for basically creating editorial
Great.
information for other doctors right
Sure.
here in the state of New York.
Sure. So it's interesting because I have dibbled and dabbled in a lot in a relatively short career. I've always been made it, if I don't like something, then I'm in charge of changing it. Last year I was just like making that big transition and really focusing and being willing to be really flexible with my schedule and really committing to that. Again, I haven't necessarily, I'm still kind of, besides mentoring, I'm figuring out how I'm going to be involved, for example, in our local society here in New York City again, because I had to take a step back while I was figuring out my career. I think there's so much to be involved in, and I do think it's a process. Then if one thing isn't really your calling, that means don't give it up. Try something else.
Yeah.
There's so many different opportunities, especially, we all need, like I said, we all need each other. So if one thing isn't really speaking to your calling, try something else. And if that's not working out, try something else. So I'm still a little bit in that stage, I would say, but I keep trying different things. And yeah, I think to me, it's about the people. I'm inspired by my colleagues. I'm inspired by my patients. I'm inspired by these students and residents. finding those little gems every day and being grateful for those is really key for me. So, the world is my oyster, so to speak. We'll see where it goes. We'll see where I am in a year or two from now. I'm really grateful for the journey.
Thank you so much, Elza. Thank you for being here and part of the podcast.
Yeah. Thank you so much, Dr. Allen. It was great to be here and doing this at Vision Expo East and having a great day.
So thank you again.
Yeah.